This is a brief demonstration of a new product developed by Applied Neuroscience Incorporated that's inside of the software platform referred to as NeuroGuide. This is a rehabilitation index to help clinicians track changes in brain networks as a function of time or a function of treatment after patients are entered into their rehabilitation program. We call it the BrainRehab Index. It's a series of indices based upon the networks that you see here. It shows a similar format that we have for the concussion index, but it's totally different in that it does not involve any patients with traumatic brain injury and also does not involve the use of discriminant function. What one can see here is a radar map with different networks. In this case, the addiction network, anxiety network, attention, the dorsal attention, the ventral attention network, the default network, executive network, memory, mood, pain, and pleasure networks. Each of these networks comprised of several Brahman areas, both in the left and the right hemisphere. The radial distance from the center is the average distance from normal. So there's a large group of normal subjects that are used to evaluate the distance that a patient is with respect to that reference, and that's over here on the left for good. It also has plots of the history in terms of good, fair, moderate, or poor as a function of the number of tests or time, and the average z-scores, that is the distance from normal, absolute z-scores, as a function of tests, of EEG tests, treatment, or time. Now there's a breakdown of the individual networks that you can see here. For example, this is the addiction network with the dial that will hopefully change as the patient improves. And the Brahman areas that comprise the addiction network are shown in these radar maps for the left hemisphere. Brahman area 13, 24, 25, 32, 34, etc. up here to Brahman area 47. And those are the same Brahman areas, but now in the right hemisphere for the addiction network. This is the anxiety network, the attention, the dorsal attention network, the ventral attention, default network, executive, memory, mood, pain, and pleasure networks. This device is used in pain rehabilitation and a lot also in drug rehabilitation for people with substance abuse, addictive disorders. For example, let's say a patient comes into the clinic with a severe pain disorder and or a drug addiction disorder, and we measure the EEG inside of NeuroGuide and then activate the BrainRehab Index, and you can see that this individual's networks are 3 standard deviations up to in most of the regions, and on average, it's in the red dial area of poor on the right side of this dial, and you can see that a bar graph showing there's just one test of the distance or the grading from good, fair, moderate, or poor. And you can see for each of these networks, the distance from normal for the addiction network, anxiety, attention, default, memory, mood, and of course, pain network. And you can see that Brahman area 13, for example, and Brahman area 32 are the most deviant from normal in the pain network on the right side. Now the patient comes back in for another test after treatment or time, and you can see now he's moved towards a more favorable but still poor distance from normal. And that's signaled here again by each of the networks on the red line, which tells you which test this is. And you begin to see how the networks are changing. You can isolate those networks by just looking at one or two or whatever you want by selecting them here, and they will disappear from this chart. You can also print this output and save it. Then the networks, individual networks, are seen and how they've changed on the second test compared to the first test. Now the patient comes back in sometime later, a third test is done, and now he's in the moderate range. He's clearly improved. We can go down to the pain network and see that the pain network itself has improved. And you can see which Brahman areas have improved. This allows you, if you're doing neurofeedback, to target the most dysregulated Brodmann area. In this case, it's the right Brodmann area 13 and Brodmann area 32. That's still somewhat deviant from normal. Now the patient comes in again and is moving again as we measure the EEG towards more favorable output. I'm not going to go through all of the tests. In this case, by the 6th EEG test, this patient was in the good range, and 7, it's even closer to normal, which gives us a more complete picture of the network history, how it changed from the first test to the third, and not too much more change after that. And then you can see the bar graphs of the categories of rehabilitation in the rehab index in this bar graph. And then you can see each of the networks. You'll see that the addiction network is still deviant from normal. The attention network, that was normalized. The default network is getting much better. And most importantly for this patient, the pain network now is in a good area. And of course, you're examining the patient's symptom severity and linking that to neurofeedback or to whatever method of treatment that you wish. And again, you can always save and print this brain rehab index anytime you wish. You can also review it at no cost. This is a per use product, so that you're charged every time you do a test. You can also set the threshold for the Z-scores. If you go low enough, you'll see that that they will not normalize. If you go high enough, then everything normalizes. So you can set your threshold as you wish to see how changes are happening in these different regions of the brain by changing the threshold. So that's a demonstration of the Brain Rehab Index. It's designed to give feedback to the clinician so they can see which brain networks are moving in the direction of a healthy, normal reference population, which ones to pay attention to when it comes to treatment, whether it be brain stimulation or it be neurofeedback, where you can target the particular Brodmann areas that are deviant from normal.